Kia ora koutou and welcome to this online session of StAC Talk. My name is Tom Matthews, no mai, haere mai. In today's session, we're going to be talking about the signs and symptoms of concussion. We're really lucky to have Jeremey from the Laura Fergusson Brain Injury Trust with us. Thank you for coming to the studio, Jeremey. Over to you.
Thanks, Tom. I'm Jeremey from Laura Fergusson Brain Injury Trust, and I'm a clinical psychologist over there, and I'm just here today to talk a little bit about what we offer as an interdisciplinary service that treats people who've experienced a concussion. So our service is mostly funded by ACC, and what we provide is we provide assessment and rehabilitation treatment for people that have experienced a mild traumatic brain injury, also referred to sometimes as a concussion. So sometimes hospitals and GPs will switch between the terms, but essentially, for your purposes, they mean the same thing. Input is provided by, as I said, an interdisciplinary team. So you may encounter one or all of these people, and we sort of make decisions as we assess and treat you as to which ones are required to treat your concussion most effectively. Probably the only one that sticks out here that people are not terribly familiar with is neuropsychology. That's the assessment of people's cognition, information processing, attention, thinking and things like that, and really critical for people to have a good sense of that if they're going to return to school, training, education and things like that. So typically we accept referrals from Christchurch Public Emergency Department, after hours GP, people's regular GPs, those sorts of avenues. So what the doctors typically do is they meet with a person, a young person or an adolescent, and they'll diagnose a concussion based on the signs and symptoms that are reported to them. It's really important that the doctor actually records the word concussion on the referral because that makes a difference to ACC and it just increases the chance of the process flowing smoothly through to our service. Yeah, as I've said before, the referrals can be made by either the doctor or directly from the hospital. Doesn't really make a difference from our end as to where the referral comes from. We will provide contact with you as the person who's experienced a concussion once we've received the referral and triaged it appropriately. What should you expect? Well, typically we meet with a young person or an adolescent, sometimes with or without their parents, depending on what's appropriate, and we conduct a very detailed and expert level assessment of their signs and symptoms and provide some initial education about concussion injury, what to expect in terms of treatment and rehabilitation, and also essentially what is normal and what we're seeing when the person presents for assessment. We identify, which of those people are required off that first page, so whether it's a combination of physiotherapy, a bit of clinical psychology, maybe a little bit of occupational therapy. We sort of work out which particular therapies are most appropriate to ensure a smooth recovery from concussion. We also are able to provide referrals for medical follow-up, audiology, optometry, those additional services as required if we identify those as important throughout the assessment phase. And importantly, if longer-term issues persist, then we're able to communicate with ACC and the GP and provide recommendations for longer-term support. These are the really, really common signs and symptoms of a concussion injury. So fatigue and drowsiness, headache, that's sort of approaching 100% of people we see with concussions. Often we see people with light sensitivity, noise sensitivity, and you can think about those sort of symptoms in the context of a school return. Sometimes that's very problematic. So we also see people with dizziness issues, trouble processing information, trouble with concentration and attention. Again, highly relevant for adolescents and young people who are returning to school. Nausea and vomiting, a little bit less common, but these sort of signs and symptoms we see here are typical for a concussion injury. It's not that everybody has all of these symptoms, usually it's some combination of these. So we work, as it says down here, Brain Injury Trust. We see predominantly people with concussions and brain injuries, so we've got a lot of experience in this area, and we see that most people who experience a concussion recover reasonably smoothly and within a reasonable time frame. They typically do not need long-term support. So people sometimes have a few misconceptions about a concussion being done and dusted in 48 hours or a week, and sometimes go the other way and just concerned that this is going to drag on for years. So those are sort of extreme ends of what we see. So we typically don't expect people to have long-term needs following concussion. Sometimes it takes more time to recover, and what we see typically with younger people is that the inclination is to push through, return to things like sport and study, education, and the issue is that we see is that people push through and return at too high a level too early. What we see is that the recovery essentially slows down. So that is frustrating, understandably, for the people, and we sort of try and dance this line where we allow them to maximise their independence and what they're doing, but within sort of a sensible envelope, so that they don't push through and burn themselves out. You, of course, can be at a higher risk from another concussion while you're recovering. If you think of a concussion and people have got significant balance and dizziness issues, obviously they're at a higher falls risk, so we just encourage people to be quite careful about their return to activity, such as travelling and sports and study and things like that, so as not to experience another concussion. You can still experience concussion symptoms even if you're not knocked out and lose consciousness. So a lot of misconceptions around what concussion actually is. You don't need to lose consciousness necessarily to experience a concussion injury. Concussion and brain injuries sometimes sort of mixed together by GPs and by hospitals and in the way people talk about them, and that sometimes is a bit problematic. Concussion is at the lower severity end of that spectrum. Down the bottom here is the ACC website has lots of guidelines regarding return to sport and study and training, and that is a really good resource for people to consult as to what to expect following a concussion injury. Down the bottom here is our website, and that contains also a lot more information around the services we offer and more detail about concussion treatment and recovery.
Look, hey, thank you for that, Jeremy, and thanks for staying. We've kept Jeremy on the couch along with some of his team to explain sort of the breadth of services that they offer at the Laura Fergusson Brain Injury Trust. So, introducing the couch, we've got Max and we've got Sophie and Hannah. Now, Max, you're the lead physiotherapist. What does a physiotherapist have to do with concussions? What's your role there?
Physio can support in a number of ways after a concussion. One of the most common that young adults or children like us to help with is a return to sport. So we can help provide guidance around that. So helping to support people with recovering from headaches as well.
Yeah.
And these can come from issues with the neck, but also issues with vision. And then we have vestibular issues as well. And that's issues within the inner ear that affect our balance and visual spatial sort of coordination. And it can result in really nasty sort of double vision or dizziness, like the room spinning around them. And we can help with targeted exercises to help recalibrate the system and desensitize it as well.
Right. So a lot of work you're doing with those students.
Yeah, absolutely.
Yeah, very good. Thank you. Sophie, you're a speech and language therapist. So what role do you play with concussion? What's your job there?
So following a concussion, it's very common for people to experience symptoms such as those memory changes, attentional changes, difficulty with processing. So within school, that can present as maybe things such as difficulty paying attention during classes, difficulty kind of getting through exams, difficulty with kind of learning in general in that study preparation. So speech language therapy can kind of support with all of that. And then we can also address other things such as any changes to sort of that social communication and difficulties with things like fluency or finding words you want and things like that as well.
And will you work directly with the teachers in the school or parents?
Yeah, absolutely. Yeah, so we can liaise directly with the school along with anyone else who's required. So it might look like occupational therapy or physiotherapy, liaising with kind of whoever's involved, whether that's teachers, sports coaches, and parents as well.
Yeah, good. And I imagine that could be quite for a long amount of time after a concussion.
Yeah. So that support can be ongoing. Typically, we would expect it to be kind of up to 6 months, but if it can go for longer, and we can continue to kind of get the support for that if that is required.
Yeah, very good. Thank you. Now, Hannah, you're an occupational therapist, so your role is different again. Mm-hmm. So, a student gets a concussion. How do you help that student?
Well, it's very common following a concussion for a student or an individual to have challenges with increased fatigue symptoms. They may struggle with planning, especially in the educational setting, so for adolescents, and may struggle as well with things like their attention that I would work with the speech and language therapist on. But as an occupational therapist, we will provide fatigue management and education and activity alteration where required to support engagement in their occupation, such as education and school. And where needed, we'll provide sleep hygiene and education to support with sleep disturbances. And we take an interdisciplinary approach where we may work with the speech and language therapists or the physiotherapists to support with things like memory and attention. We'll also liaise directly with the school or institution and the client and their family to support with continued engagement whilst they're recovering from their concussion.
Yeah, but again, very much a wraparound service to help get these people back on their feet and back to the place where they need to be. Yeah, thank you. Look, I'm also interested, Jeremey, from your presentation, the effects on mental health and concussion, and do we expect a change there? Is it going to have a big impact?
Yeah, it's a good question, Tom. There's a number of things that people typically experience when they have a concussion, and this kind of applies to adults and children as well, that when you have a massive change to the way you interact with the world and your vision might be out of whack, or your processing and your concentration might be a little bit changed, understandably people get a bit tense and anxious about that. And they have questions in their head like, oh, how long is this going to last for? You know, is this going to go away by itself? Am I stuck with this long term? And those kind of questions drive anxiety in people. So we typically see anxiety rising in people who've experienced concussion. And on the other end of the spectrum, we also see people's mood change because they've got their lives up and running, they go to school, they play sport, they interact with their friends, and their concussion might be such that they're not able to do those things for a short period of time. And when your typical coping strategies are taken away from you, things tend to fall over mood-wise. So those are two very common things that we see with concussion. Probably the dark horse of the bunch is the neuropsychology involvement, which is when people experience concussion-related attention, information processing, and speech issues, we sort of are able to get a neuropsychologist from our team to do a really formal assessment and screen out what some of the things are and sort of codify and quantify whether the attentional issues are significant, and therefore what do we do about it? What are some strategies that you can put in place to get the best out of your attention? So it's quite a diverse service as you've seen, and one of the benefits is working with people like this is that we all get to work together to coordinate the care and return of that person who's experienced concussion. So yeah, it works really well. Yeah,
you can see that sort of team dynamic, and the change in a student who's been concussed is quite dramatic and subtle in some ways. So it requires a whole wraparound. Yeah. So that to be able to understand that, to be able to I guess get that kid back on their feet.
Yeah, the benefits of the service is that at the assessment phase we work out which of the different characters are involved and which people need to be on the team in order to best support this person to return back to whatever they were like before the concussion. So it's not always necessary that everybody's involved. It's not always necessary that people have, psychology involvement. If their mood and coping is fine, they're dealing with things appropriately. Maybe someone like myself's not on the team, but, it's much more common to have lots of different therapists working together to coordinate the care really efficiently for that person.
Yeah. Brilliant, thank you. Thank you, team from the Laura Fergusson Brain Injury Trust. Thanks for your time and for the information. I think parents feel very uncertain at times around this, but I thank you for clarifying a lot of those points. So just as we finish up, just so it's knowing the guidelines, it's following the guidelines, it's getting help. There's lots of help out there. Get the help, seek the help, and get it as soon as possible.
Yeah, don't delay.
Don't delay. Excellent. So thank you so much for your time. Now we're going to move on to hear from Bridget Ford from the Headache Clinic.
Thank you, Tom. Concussion, as Jeremey just mentioned, is a mild traumatic brain injury. What that means, it is fully recoverable if managed properly. It doesn't show on a head scan or brain scan. So it's a functional diagnosis which consists of, if you have signs of symptoms, 2 or more of these, consisted also with a direct blow to the head, face or neck, or an impulsive force through the body. So it's really important to note that you do not have to actually hit your head to get a concussion. Now, it's not a bruise, it's a shearing, stretching force. Now, it's with this shearing and stretching that the biomechanical cascade happens. So imagine your brain like jelly on a plate. We move the plate, the jelly moves and stretches and morphs and comes back. This is what happens with the brain. When we get this stretch, we have millions of neurons in our brain that are connected by axons. So when we get the stretch, these axons open, and what is outside the axon comes in, and what is inside the axon goes out. This sets off an action potential to all the rest of the neurons in the brain and sets off the first phase of concussion, which is the excitatory phase. This happens for seconds to hours, and it is followed by a spreading depression or an energy deficit. So this graph here is showing on the vertical is our brain energy levels or our ATP levels, and on the horizontal is time. So you'll see at the top here on the blue line, we're tracking along at 100% brain energy levels. We sustain a concussion. We have the excitatory phase, and that is followed by that spreading depression, and you'll see that in the decline in the graph. This is at its lowest at day 5 to 7. Then this will naturally come back up, and on day 22 to 45, this will be back at its normal previous level. What is really important here is at day 7 or 10, often people will have no symptoms. So they think that they have fully recovered from their concussion. Their brain is still building back up to that previous energy level. This is the danger zone that if you were to return to sport too soon here or get another knock, this whole process of the energy deficit goes again. So it's accumulative. So we get the excitatory phase followed by the spreading depression, and that is accumulative from a 20% after one can be up to 40% or more. This is where we're running into the danger zone of permanent damage or cell death or even death. So it's really, really important that you give your brain time to recover. Otherwise, you are resulting in permanent damage or you're delaying the recovery. If you were to go ahead, you recover from your concussion, you're fine, you're back at sport, 2 to 3 months later, you get another concussion, this is separate. It's not accumulative here. It is then you can go through that same recovery again. So just from the research, it's really important to note we can have repeat concussions as long as they're not on top of another one. Now, what next? So you've had a concussion. First thing you want to do is get off the field or stop what you're doing, okay? You need to cool down your temperature. So either sit in the shade, or it's really good to get an ice pack lying flat on your back to your neck. This will help with this. You then, as a parent or peer, you want to monitor this person for the next 2 to 3 hours. This is a really critical window that if there is deterioration in symptoms, it could be a sign of a more sinister injury to the brain. So what can be quite good at that next 2 to 3 hours is get people up every hour or so, get them to walk around, see if balance is changing, ask them questions, see if they're getting muddled or they can't answer those questions. So you're looking for a deterioration. If in any doubt with any of the symptoms, go get a medical review at this point. If you get past that 2 to 3 hours, they're fine. You can let them sleep at that point. That is safe. But I know as a parent, you want to be sure. So it's okay to go in and just listen to their breathing and check if that's changing. That can be another sign that you could then wake them up, check if they've deteriorated, and then you can still take them off for that medical review. What we have found, the best predictor of recovery from a concussion is getting assessed by a trained healthcare professional within the first 5 days. Really, really key, okay? So that you don't go on to develop persistent symptoms and don't go on to develop issues further down the track. Now, management of this has changed a lot over the years, and it used to be go home and rest. It's really, really key that it's relative rest. It's not complete rest. So for the first 48 hours, it's important that you try and potter around and keep yourself as active as possible. It's also important here to have modified screen time, but not a complete cessation of that. If you take out all the normal stimulus from the brain, it finds it really, really hard to recover, okay? To work out how much of this to do, we work on a symptom symptom scale of 0 to 10 and not pushing those symptoms up by more than 2 points. So if you have, for example, gone for a bit of a walk, your headache was at a 0, it's gone to a 3, you've pushed too far, you need to stop, you need to rest, you need to let it settle. You can then have gone from no headache to a 2, and then that's okay. You can potter along at that point, rest, and then go again. So we talk about nudging or pottering. The next stage here is for return to sport. An athlete must return to school before they return to sport. It can't be done the other order, and I know a lot of your teenagers will want to do that. They can run in conjunction together, but it's really important that there is a full return to school before sport, and very, very important before a full return to sport that you are asymptomatic, so you don't have any of your concussion symptoms. Because real key here is, yes, ACC have got great guidelines and they've got the 3-week stand down, but the brain takes 22 to 45 days to fully recover. So you can see from that 22 days or that 3 weeks is very much on that lighter end. So please be aware of that. Now, services that we provide at the headache clinic, we deal a lot more in concussion. Yes, we deal with headache and migraine, but we do an education assessment and we give a tailored treatment plan for that individual, depending what their needs are. We are manual therapists, so we're physiotherapy trained, and we specialise or treat exclusively in the top part of the neck. Okay, so that's what happens with a concussion is actually you get a neck injury or whiplash injury with this. So this is what we commonly see as missed or not treated well, and why people can have ongoing symptoms. We also offer baseline testing. So a full way to know if someone is fully recovered from a concussion and can go back to sport is they've had a baseline test before their concussion to know what their normal is in terms of memory and balance and neuroprocessing. So that's the absolute clear way to know that that individual is back to normal. If you are needed to come see us, there is no referral necessary. We are under ACC and we are private. So what we do offer is if you are unsure, you can ring 0800 Headache and we offer free 15-minute phone consults to answer any questions or for you to establish whether we're the right people to come and see.
Hey, thank you for that, Bridget. Really appreciate the crisp and sort of concise information within that. And I'll grab Bridget for another few seconds on the couch. Ask her just a few more questions to follow up. Bridget, thank you.
My pleasure, Tom.
Look, the amount of energy or force to sustain a concussion, what's actually needed there? Because I think there's some people might think it's a big knock to sustain that.
Well, the average force is 96 G of force to sustain a concussion. So it can be as low as 70 and it can be right up there in the mid-hundreds. So that's the average force. The big key factor here is all that you need to disrupt or sprain the top part of the neck is 4.5 G of force. So not only when people get a concussion, they also get a whiplash injury, and the symptoms of concussion and whiplash are the same. So they both need to be addressed at that same point, because it can be that whiplash injury that can be the ongoing symptom cause.
Just to clarify, if a force was at 4.5 Gs or 70 Gs, what would that be equivalent to if I was watching that as a parent? So 4.5, what did that look like?
4.5, that's a harder one to probably gauge. The force, I think that's the thing. Force is one part of it, but it needs the symptoms with it. Okay, so if you are unsure, you always, if in doubt, sit them out. If you aren't sure, you go, that was a big hit, I don't know. You're better to err on the side of caution. But basically you can gauge if they have 2 or more symptoms, whether they are very quick or they're longer lasting. That is the definition of a concussion.
So it can come in lots. The symptoms are more important than a big head knock. It could be a whiplash. It could look like a whiplash, but it's more serious than that. Thank you. But if I only had symptoms for a short period of time after my concussion, now I'm symptom 3, does that mean that I'm good to return to sport?
No, and this is that danger period. Okay, this is why ACC have put in that 3-week mandatory stand down, and I know you at StAC have imposed this, and I know other schools are doing that as well, which is great to see. But you would have seen from my stats, is 22 to 45 days for that brain to fully recover in terms of its energy levels. If you sustain a concussion again when it's recovering there, like I said, that is that permanent damage, long-term damage, or a much longer recovery. It's just not worth it. So symptom resolution does not mean you have recovered if it's within that short period of time.
So as a parent, we need to be quite firm with that and probably hold our kids back a wee bit, because they're often trying to get back out there to play sports again and get back out there to support their team or a representative game, whatever it is. They're really quite keen not to get back into it,
Yeah.
not to show you the symptoms.
Very much so. What is important there, though, no, you don't want them playing, but it is really important that they keep up that social interaction.
Right.
So it is important to still be part of the team and support the team, but just no risk of another head knock. So the return to practice is guided, and then the return to play, they need to be past that 3-week period at least and symptom-free.
So as schools, as parents, that's what we're pushing.
Yes.
What if am I concussed if I didn't knock myself out? So I haven't lost consciousness. Am I still, is it possible?
No, so actually only 10% of concussions will have a loss of consciousness.
Right.
So we see this quite a bit in clinic, that people will come and say, I've had a mild concussion because I didn't knock myself out.
Yeah.
A concussion is a concussion, and it's really important. You can have mild symptoms, but the injury to the brain is the same, whether you knocked yourself out or not.
Is that
and
right?
that's not used as a measure.
Right. Okay, so we throw that out as a key sort of indicator.
Absolutely.
Now, persistent concussions, I want to know how common they are and a little bit more about that.
Yeah. Well, persistent concussion symptoms or syndrome is defined as symptoms that last for more than a month. So, and actually 30 to 40% of concussions will go on to develop persistent symptoms. So why I said about coming to see a trained healthcare professional early, you are reducing that risk of developing persistent symptoms to less than 5%. So it's a massive decrease if you get in early, get addressed, get educated, and get some treatment as required. You're decreasing it by your risk of persistent symptoms by 30 to 35%.
So you go quite strong on the treatment and straight away to prevent being out for the whole season.
Yeah, and absolutely, and education. Education is a key as well as to what to do and when, and how to pace yourself and when to return to certain activities.
Yeah. I am curious, Bridget, with the barriers that we have at school here is some people are so keen, and there's a bit of mana about, a bit of a head knock, but I'm back and playing the game, and maybe kids won't even tell coaches that they have been concussed or potentially concussed. Are there ways that you've seen as parents that we can help counter that attitude towards, and sort of a cavalier attitude towards their brain?
I know it's hard, because I think as teenagers, and I'm seeing this, I have teenagers, their thought processing of that, they don't look at the ongoing effects. So we as parents or caregivers or teachers or coaches, we have to be really on top of that and reinforce that this is so dangerous, that it can be permanent. They only have one brain, okay? And it's not being macho to go, oh, well, I'm good now, I'll go back. It's just stupid, actually. So it's really trying to reiterate, you're being smart, you're being clever, and you're actually being strong by doing that mandatory stand down and getting yourself better and back to full health and recovery.
And I think it's good that's backed up by by how professional sports people are taking it so seriously now.
Yeah.
Thank you, Bridget. Thank you for the time. Thank you for the information you've shared with us all in the community. Look, thank you for tuning in, and thank you for listening to this session on concussion and how to prevent, how to treat it once it's happened. I hope that you know there's heaps of help out there. Ka kite anō, and we'll see you next time. Bye.